Hello everyone, my name is Gunukula Snithu Reddy of MD second year. Today I am going to examine mouth, nose and neck. I am one of the medical second year student. May I know your name and age please?
Yes, my name is Snithu Reddy. My age is 49.
Today I am going to examine your nose, mouth and neck. Is it okay for you?
Okay.
The equipment required for the examination are otoscope, tongue blade, gloves and a pen light. Learning objectives for the nose, mouth and neck. Identify key anatomic structures of nose, mouth and neck. Master examination techniques for the nose, mouth, pharynx, neck, thyroid gland and lymph nodes. Assess common abnormalities such as pharyngitis and changes in thyroid gland. Let's review the anatomy of the nose. Approximately the upper one-third of the nose is supported by bone and the lower two-thirds by cartilage. Note the bridge of the nose, the tip and alum nasi. The air enters the nasal cavity by the way of anterior nares, passing on either side through the widened areas known as vestibule. The nasal septum forms the medial wall of each nasal passage. Like external nose, the nasal septum is supported by both bone and cartilage. Vestibule has hair-bearing skin rather than mucosa. Air enters from vestibule through the narrow nasal passages to nasopharynx. There are curving bony structures covered by a highly vascular mucous membrane. There are superior turbinate, middle turbinate and inferior turbinate. Below each turbinate is a groove or meatus, each named according to the turbinate above it. Nasolacrimal tract drain into the inferior meatus. Paranasal sinuses drain into the middle meatus. Paranasal sinuses are air-filled cavities lined with mucous membrane. Only frontal and maxillary sinus are available for examination. The common and the concerning symptoms of nose are nosebleed or epistaxis, hoarseness, swollen glands and goiter. Begin the examination of the nose by inspecting the anterior and inferior surfaces of the nose. Note any asymmetries or deformities. Some asymmetry of two sides is normal. Test for obstruction by pressing on each alum nasi and asking the patients to breathe in. Then ask the patients to tilt the head back and press gently on the tip of the nose and shine a light to get a partial view of vestibule. To inspect the inside of the nasal passages, use an otoscope with the largest speculum available. Note to insert the speculum carefully to avoiding contact with the sensitive nasal septum. Repeat the procedure on other side of the nose. Note the color and condition of nasal mucosa that covers the nasal septum. Note any deviation, inflammation, perforations or polyps or ulcerations. And examine the nose by inspecting the sinuses for any tenderness. Press on the frontal sinuses from under the bony brows, then press and examine the maxillary sinuses. Clinical findings of nose are mucosa is pink, septum is midline and there is no sinus tenderness. Lips are muscular folds surrounding the entrance to the mouth. When the mouth is open, the gums or gingival mucosa and teeth become visible. The gingiva firmly attaches to the teeth and mandible or maxilla. Note the scallop shape of gingival margin and pointed interdental papilla. In dark-skinned people, gingiva is partially or diffusely brown, whereas in light-skinned people, it is pink. Midline mucosal fold, labial frenulum, attaches the lip to the gingiva. Adjacent to the gingiva is the alveolar mucosa which attaches to the labial mucosa. The dorsum of the tongue is covered with papillae, giving it a rough surface which is usually appear as red dots covered by white coat. The undersurface of the tongue has no papillae. Note the midline lingual frenulum that connects the tongue to the floor of the mouth. The duct of the submandibular glands open on the papillae that lie on each side of the lingual frenulum. Above and behind the tongue rises the arch formed by anterior and posterior pillars, soft palate and uvula. Between the pillars, tonsils can be seen in their fossa or cavities. Between the soft palate and tongue, the pharynx is visible. The hard palate forms the roof of the mouth. Start with inspecting the outer surface of the lips for symmetry, color and moisture. Note any lumps, ulcers, cracking or scaling. With good lighting and with the help of tongue blade, ask the patient to open the mouth wide and inspect the oral mucosa for color and ulcers. Note the color of gums, inspect the gum margins and interdental papilla for swelling and ulcerations. Also, inspect the teeth, noting that are any missing, discolored or abnormally positioned. With the thumb and index finger, inspect any teeth that might be loose and lead to the risk of aspiration, especially in the older adults. Next, inspect the color and architecture of hard palate. Ask the patient to say ah. As the patient says ah or yawns, note the movement of the soft palate and uvula. The soft palate should rise symmetrically and uvula should be positioned in the midline. If the patient's tongue obstructs your view, use your tongue blade to depress it and not so farther that cause gauging. Inspect the anterior and posterior pillars, tonsils if present and pharynx. Look for redness, exudates or ulcerations. None should be present. Continue by inspecting the tongue, note its symmetry and color. Inspect the dorsal surface, which is rough due to papilla and sometimes covered by thin white coating. With the left gloved hand, grasp the tip of the tongue and gently pull it to the patient's left to inspect the undersurface and sides of the tongue. Look for white or reddened areas, nodules or ulcers. Palpate the tongue with the help of gloved hand, looking for any indurations. Repeat the same procedure on the other side of the tongue. Clinical findings of mouth. Oral mucosa is pink, dentition is good, tongue is midline, no ulcers, tonsils absent, uvula is good position, and pharynx is without exudates. To begin the examination of the neck, inspect for symmetry while standing in front of the patient and note any masses or scars. Look for the enlargement of parotid and submandibular glands. Note any visible lymph nodes. Palpate the lymph nodes using the middle and the index fingers. Move the skin on the underlying tissues in each area. The patient should be relaxed with the neck flexed slightly forward if needed. Turn slightly towards the side being examined. Palpate the anterior superficial and deep cervical chains, including the supraclavicular nodes located anterior and superficial to the sternomastoid. Things to note about the nodes are its size, shape, delimitation, mobility, consistency and tenderness. Feel for periauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical and posterior cervical nodes. Enlarged or tender nodes call for re-examination of the regions they drain, careful assessment of the lymph nodes elsewhere. Now, inspect and palpate trachea for deviation. Place your fingers on one side of the trachea and note the space between it and the sternomastoid. When compared to the other side, the spaces should be symmetric. Next, start the examination of the thyroid by inspecting the patient's neck. Tilt the patient's head back a bit and inspect the region below the cricoid cartilage for the gland. Ask the patient to extend the neck back slightly again as he sips some water and swallows. Observe the upward movement of the thyroid gland, noting its contour and symmetry, often a butterfly shape. Confirm your visual observations by palpating the thyroid gland. First, locate the isthmus, usually overlying the second through fourth tracheal rings. Palpate the adjacent right and left lobes as you stand facing the patient. Look for goitre or enlargement of these lobes. Move behind the patient and place the fingers just below the cricoid cartilage. Ask the patient to sip water and swallow it. Feel for the thyroid isthmus rising under your finger pads. Displace the trachea to the left with the right hand and palpate the left lobe of the thyroid. Similarly, displace the trachea to the right with the left hand and palpate the right lobe of the thyroid. Clinical findings of neck are no lumps and goiter and pain. There are no swollen glands noted in the patient.